impact of COVID-19 on women professionals in the Kenyan public transport sector. It is no doubt that COVID-19 has had drastic implications on life in Kenya, and the public transport sector has been one of the most affected areas. Now, to better understand the needs and impact of COVID-19 on women professionals in public transport, an organization called the Flown Initiative surveyed 30 out of 70 women working in the PSV sector within the Nairobi metropolitan area. That survey forms the basis of our conversation this afternoon with our able panelists. And we begin with Elizabeth Njoki. She is a successful transport professional with a passion for the matatu sector. Elizabeth Njoki has 10 years of experience working as a bus terminus manager as well as a conductor. She is equally well versed in public transport safety guidelines as well as customer relations. She has been prominently featured in Voice of America TV broadcast as well as Kenya's Business Daily as a woman trailblazer in the transport industry. We'll be speaking to Elizabeth Njoki in this forum. Also joining us is Dr. Juliet Kimemia, who is the immediate former Minister of Infrastructure, Transport, Public Works and Utilities in the county government of Kiambu. She also served as the Minister in charge of Industrialization, Trade, Cooperatives and Tourism under the same county government. By extension, Dr. Kimemia has served as a chairperson of the National Caucus of Infrastructure Ministers at the Council of Governors, where she spearheaded policy development as well as implementation for public transport and county fleet management, among other roles. It is also worth mentioning that she has sat on the board of the Nairobi Metropolitan Area Transport Authority, NAMATA. Quite a mouthful there and quite a profile. And also joining us this afternoon, our final panelist is Naomi Mwaura, founder of the Flown Initiative, a women-led organization working towards the creation of safe, sustainable and accessible public transportation spaces for women and vulnerable groups in Kenya and across Africa by influencing behavior change, generating knowledge and movement building as well. Ladies, thank you for joining us on this special forum. Naomi, let me begin with you as the founder of Flown Initiative. When did this initiative begin and why?
Yes.
So the initiative began in 2011, but we were formally registered in 2013. And we were about 3 girlfriends back in university, USIU. And whenever we met, we were continuously talking about the challenges we were having accessing public transport. And it kept coming up in conversations with my girls. And we were trying to figure out what interventions we would implement. And we started looking for data. But we could not find data on women experiences in public transport. And that is how Flown was born. We felt that there were lived experiences that we had that were not reflected in research or policy making.
Now, Flown Initiative went ahead and carried out a survey, surveying 30 out of 70 women working in the PSV sector within the Nairobi metropolitan area. What informed this survey to begin with? And let's speak about the findings.
So Flown has been working with women in the public transport industry in the Nairobi metropolitan area for about 2 years. And we've been building their capacity in various areas, including customer service, traffic, and any other trainings that they required. And when COVID came about, our women reached out to us with various issues. And so we decided to conduct a survey just to understand what's happening both in their professional and personal lives. And that way we could design the interventions that over the past couple of months we've implemented.
Now, Dr. Kimemia, let me come to you. Out of this survey, the findings say 52% of the women working in public transport had lost their jobs. 97 of those now living in fear that they will not be able to provide food for their families. 30% of those have already defaulted on rent for several months now. What is your take on the situation?
Thank you, Michelle. The the COVID pandemic has really hit this particular industry very hard. And in any situation, women are disadvantaged. They bear the brunt of a lot of the negative impacts of this. So looking at the women in transport, both as users and as investors and people who work there, it has been extremely difficult for them. First of all, the protocols that came with the COVID pandemic was disadvantaged women more because everybody was told to stay at home. Most of them are single mothers, and the space is largely dominated by men. So the differences that have come up in relation to the effect of COVID is very, very disproportional negative effect on the part of women. They had nowhere to leave their children. Many of them are single mothers. The restrictions of the curfew, especially when the curfew was commencing at 7, many of the women could not even feed their families. The worst bit of it is that this sector is highly informal, very unregulated, and therefore were not captured even when the regulations were being gazetted. As it is now,
right.
These women who are, we can say they run small SMEs, are not able to take advantage of the programs and the resilience building agenda that has been coined by the government. Yes, so what the key lesson here should be a deliberate effort to regulate the industry, register the SMEs here, and create a multi-sectoral approach where transport sector speaks into the health sector, water sector, so that there is comprehensive address to the challenges they are currently experiencing, and what has been put aside by the government as a resilience building agenda.
Right. Let me bring in Naomi
this particular
just for a moment,
sector,
Dr. Kimemia. Just hold it there so I can bring in Naomi. Naomi, the survey says 52% of the respondents revealed they no longer are employed because the owners of the matatu they were employed in have closed down their businesses due to COVID-19 restrictions. Now, what impact does it have, not just on their lives, but because having more women in the matatu industry, whether conductors or the drivers, made it safer in general for women to access and use public transportation in Kenya?
So the impact has been most of the women have either gone to other industries, but in addition, because they're on unpaid forced leave, they've had to rely on short-term jobs. For example, most of them are conductors, but now because of COVID, they either have to stand in for a colleague who is having an off day, or they are sometimes, if they're lucky, called in to fill in the vehicle. So usually they would go home with about 600 to 1,200 Kenya shillings per day. But now with COVID, they're going home with about 100 shillings to 200 Kenya shillings. In addition, there has been the issue of sexual exploitation. because, again, as I mentioned, they are relying on former colleagues to give them jobs. And there have been issues of where male colleagues would ask for sexual favors in exchange for these short-term jobs.
Dr. Kimemia, the matatu industry, the public transport industry, is a multi-billion shilling industry in the country. You have sat on several boards, including the Nairobi Metropolitan Area Transport Authority. How can these women in the public transport sector, which you mentioned is largely informal, be catered for and, you know, be registered, have associations that they can go to in times like this?
To me, the COVID pandemic has come in as the wake-up call for the entire transport sector to be relooked into. If you look at the national level where we are, the National Transport and Safety Authority is domiciled in the Ministry of Interior. There is a State Department of Transport, and Namata is domiciled in the State Department of Urban Development. So looking at the sector, it is found in three state departments that are not related in mandate, and that has, I think, has contributed a lot to the confusion that we see, and the description of the transport sector is a chaotic sector. So my view going forward.
All right, Dr. Kimemia, I am sorry to interrupt you. I understand that President Uhuru Kenyatta is at this very moment addressing the nation. Let's cross over live and listen in.
Good afternoon. Fellow Kenyans, 30 days ago, actually on July 27th, 2020, I did promise once again to appraise and, where necessary, to escalate or to de-escalate the steps taken so far to contain this COVID-19 pandemic. I promised to do so because most of the steps that we took were conditional. Whether they worked or not depended on how we responded to